Good afternoon. My name is Maxwell Kane.
And I'm Owen Gillis.
Today we will be briefing you on lung cancer. Our briefing will include basic terminology, types, symptoms, causes and risk factors, stages, diagnosis, statistics, impacts, cures and treatments, and new research that has been found.
Lung cancer is cancer that begins in the lungs. It is often characterized by severe cough, appearance of blood and cough, and shortness of breath. There are two main types, one called small cell and the other is called non-small cell. Most of the time, it is not diagnosed until the far stages of it due to people just thinking it's just a little cough. When people start to realize they have it is when the cancer begins to uncontrollably multiply and grow, resulting in malignant tumor formation. Once it gets to this point, survival chances greatly decrease. In the briefing, you will be educated on what lung cancer is and all the little details that everyone should know before it happens to them.
Here are some basic terms you should know before we begin our briefing. Benign, non-cancerous tumor, malignant, cancerous tumor, biopsy, taking out a piece of tissue to see if it is cancerous, oncology, the study of cancer, localized cancer, cancer that is confined to an area that is not yet spread, metastasis, when cancer begins to spread and damage other tissues, oncogenes, genes that help cells grow, divide, and stay alive.
The types of lung cancer are small cell carcinoma, which start in the bronchi. They are the major air passages of the lungs that diverge from the windpipe. Non-small lung cancer can develop slow and cause little to no symptoms until it is far advanced. About 70% are non-squamous types of lung cancer. Metastastic lung cancer are where the cells break away from the original tumor and spread through the blood.
There are many symptoms of lung cancer that occur all over the body. Some are coughing, chest pain, shortness of breath, coughing up blood, muscle wasting, neck or facial swelling, harsh sounds in each breath, coughing up mucus, bone fractures, changes in voice, and blood clots. The many other symptoms that occur throughout the whole body can be seen on the screen. If you or a loved one are experiencing some of these symptoms, please see your local doctor immediately. It may just be a cough, but it's better to be safe than sorry.
%80 of lung cancer is caused by smoking. Even secondhand smoke can allow your body to get lung cancer. Exposure to asbestos and other chemicals can form lung cancer. Gene changes in your DNA that turn oncogenes or turn off the tumor suppressor genes. The diagram seen on the screen shows what your lungs look like with no risk factors, what they would look like with exposure to asbestos, and other chemicals that are in the air that we breathe every day. What the lungs would look like if you were a smoker or live with a smoker, which would increase your chances of getting lung cancer by 20%. Also showing with exposure to asbestos and smoking can do to your lungs, making your chances of getting it 50 to 100 times more likely.
The stages of lung cancer differ based on the type. If it is non-small cell, the first stage is cancer found in the lung, but it has not spread outside the lung. The second stage is cancer found in the lung and nearby the lymph nodes. The third stage is cancer in the lung and the lymph nodes in the middle of the chest. Stage 3A, cancer is found in the lymph nodes, but only the same side of the chest where cancer first started growing. Stage 3B, cancer has spread to lymph nodes on the opposite side of the chest or to lymph nodes above the collarbone. Stage 4, cancer has spread to both lungs into areas around the lungs or to distant organs. The stages for small cell lung cancer are throughout one lung, to the opposite lung, to lymph nodes on the opposite side, to the fluid around the lung, to the bone marrow, to distant organs. The diagram shows the four stages of non-small cell lung cancer. It starts with a primary tumor in one lung, then spreading to the lymph node, multiplying even more in stage 3. And then in stage 4, the cancer begins to spread further into the body, forming tumors in the other lung.
For a diagnosis, you will see swollen lymph nodes above the collarbone, weak breathing, abnormal sounds in the lungs, dullness when the chest is tapped, unequal pupils, droopy eyelids, weakness in one arm, expanded veins in the arm, chest, or neck, as well as swelling of the face. If you have some of these symptoms, ask your doctor for a lung cancer exam. In the diagram, you can see how other lung cancer is detected through either x-rays, a CT scan, or a helicated low-dose CT scan can detect very small tumors, as you see on the right.
Statistics show that an estimated 154,000 Americans are expected to die from lung cancer in 2018, accounting for approximately 25% of all cancer deaths. The number of deaths caused by lung cancer peaked at 160,000 in 2005 and has since decreased by 6.5% to 150 in 2016. The age-adjusted death rate for lung cancer is higher for men than it is for women. The statistics show that it is similar for black and whites overall. However, black men have a far higher age-adjusted lung cancer death rate than white men, while black and white women have similar rates.
The impacts of lung cancer often lead to a long and painful experience that usually leads to death. The 5-year survival rate for lung cancer is 56% for cases detected when the disease is still localized within the lungs. Only 16% of lung cancer cases are diagnosed at these early stages. For cases where distant tumors spread to other organs, the 5-year survival rate is only 5%. The impact is not only hard on the person with the cancer, it is hard on their families, who are constantly having to worry and care for their loved one, which is not only physically draining, but mentally draining as well. The hardest part for the loved ones is knowing that there is a chance that today might be their last day with them. The last memory you will have with them isn't happy, it is painful and sad. Some of the cures can be determined by the genotyping to determine which lung cancers carry genetic mutations that might be treated with targeted therapies. For treatments, a rapid diagnosis and staging of all biopsy tumor by pathologists who specialize in the lung cancer. Research regarding the molecular basis of some lung cancers. Self-care such as quitting smoking, and therapies such as chemotherapy, targeted therapy, immunotherapy, radiation, and thoracotomy.
New research shows that vaping harms key immune cells in lungs along with being linked to popcorn lung. In a large clinical trial, the immunotherapy drug atezolizumab combined with standard chemotherapy regimen modestly increased survival in patients with advanced small cell lung cancer. This trial is the first in more than 20 years to show a survival improvement in this cancer. Cancer researchers have trained a computer program to scan images of tissue samples to differentiate normal lung tissue from the two most common forms of lung cancer. The program also learned to detect cancer-related genetic mutations in these samples.
Throughout our research, we have become far more educated on lung cancer. Although lung cancer is still the leading killer in cancer-related deaths, the number of deaths are slowly decreasing as the years go on, and as research and knowledge advances. With new technology and research, we can all work together to spread knowledge and eventually find a cure for lung cancer. Educate yourself on lung cancer symptoms and causes so you can decrease your chances of getting it. Get educated and save your life along with others.
The following 3 slides are a list of sources we use to get our information from. Some of the sources were cdc.gov, Science Daily, lung.org, cancer.org, and concerns.org.